Did you know strokes are the third leading cause of death in the United States? 780,000 people per year have a stroke. Today I will inform you about cerebral vascular accidents, also known as a stroke or brain attack, a disease that is both debilitating and life-threatening. In this discussion, I will include the types of strokes, causes, signs and symptoms, treatments, and prevention. What is a stroke? The meaning of a stroke is sudden death of brain cells because of the lack of oxygen. There are two different types of strokes, ischemic and hemorrhagic. 85% of all strokes are ischemic. A thrombus, also known as a blood clot, forms and blocks blood flow to part of the brain. This occurs in areas of the arteries that have been damaged by atherosclerosis, which is a buildup of plaque on the artery walls. Or it can be from an embolism, which is a blood clot that forms somewhere else in the body and it breaks off and travels through the bloodstream. It can lodge into the small vessels in the brain, causing a blockage. An example of when an embolus will occur is during atrial fibrillation. The top two chambers of the heart quiver instead of fully contracting, causing blood to stand stagnant, forming blood clots. A hemorrhagic stroke, only 15% of strokes are hemorrhagic. Hemorrhagic strokes occur when a defective artery in the brain bursts and fills the surrounding tissue with blood. Causes of hemorrhagic stroke include uncontrolled hypertension, high blood pressure. The small vessels in the brain cannot handle the high pressures and they burst. A head injury or aneurysms can also cause hemorrhagic strokes. Aneurysms are blood-filled pouches that balloon out from weakened spots in the wall of the arteries. What are the signs and symptoms of a stroke? Signs and symptoms include dizziness, trouble walking, loss of balance or coordination, speech problems, sudden weakness or numbness, especially on one side of the body, blurred or double vision, and sudden headache. Many stroke patients are left with weakness on one side, difficulty speaking, incontinence, and bladder problems. Most stroke victims require long-term rehab. That includes speech therapy to relearn talking and to swallow, occupational therapy to regain as much function and dexterity in the arms and hands as possible, and physical therapy to improve strength and walking. A person's condition is generally dependent on the area of the brain affected and the amount of tissue that was damaged. The acronym to learn for speech or strokes is FAST, F-A-S-T. S stands for the face. You look at the face. One side will be drooping or just not match the other side of the face. Look at their A for arms. You ask them to hold their arms up and one arm will droop lower if they're having a stroke. S is for speech. You want to see if they are slurred. People having a stroke cannot say a simple sentence. And T is for time. It's very important for the patient to get to the hospital as soon as possible. A TIA is a transient ischemic attack. It is a warning sign that a stroke may occur. It is a temporary interruption in blood flow to part of the brain. Signs and symptoms are similar to a stroke but last for a shorter time and do not leave noticeable permanent damage. Ways to diagnose a stroke include a physical assessment, ultrasound, arteriograph, CT scan, MRI, and echocardiograph. Treatment. Treatment includes clot-busting drugs such as aspirin, heparin, or tissue plasminogen activators, known as TPAs. These medications must be administered within 3 hours of the stroke. Also, for treatment, they can do a carotid endarterectomy, which is removal of plaque and widening of the carotid artery, an angioplasty, which is a balloon that widens the carotid artery using a stent. For hemorrhagic strokes, they're treated differently than ischemic. They will use aneurysm clipping or aneurysm embolization, which are surgical methods to stop the bleeding by sealing them off. Prevention. Controlling blood pressure, anything over 130/85 is considered high blood pressure. Then you seek treatment if you have AFib, no smoking, lowering cholesterol, sodium, and fat intake, following a healthy diet, and managing stress. Also, preventive medications such as antiplatelets and anticoagulant medications. I have informed you on strokes, the types, causes, signs and symptoms, and treatments. I hope that if you ever witness someone having a stroke, you remember the acronym FAST, FAST, and can react quickly and efficiently now that you have this information.